This video explains about stroke. By the end of this video, you will come to know about what is stroke, symptoms of stroke, diagnosis and test, treatment and prevention and risk factors. So what is a stroke? A stroke is in some countries it is better known as a paralysis stroke, brain attack, cerebrovascular accident, that means CVA, or the cerebrovascular insult, CVA. As per the World Health Organization (WHO), there are 15 million people who suffer from stroke worldwide each year, and more than 12.7 million strokes worldwide are due to high blood pressure. So what exactly stroke is? As per WHO, stroke is caused by an interruption of blood supply to the brain, usually become a blood vessel burst or is blocked by a clot. This cut off the supply of the oxygen and nutrients, causing damage to the brain tissues. There are the three major types of strokes. The first one is ischemic stroke, the second is hemorrhagic stroke, and third is transient stroke. In ischemic stroke, basically ischemia is an state that represents an inadequate blood supply to an organ or the part of the body. So ischemic stroke occurs due to interruption of blood supply to the brain cells, leading to a dysfunction of brain tissues. This happens as the blood clot interrupts the blood supply. This is the most common stroke, that is around 85% of the stroke. Hemorrhagic stroke. Basically hemorrhage means an escape of blood from a ruptured blood vessel. So when there is any rupture in the blood vessel, and hemorrhagic stroke occurs. The third is a transient ischemic stroke. Sometimes symptoms of stroke disappear within 24 hours. This is called the transient ischemic stroke. What are the symptoms of the stroke? The patient may feel problem in speaking or understanding, inability to move or feel half body, dropping face, weakness in arm or legs, change in vision, loss of memory. For easy understanding, just remember FAST. F for face. Is there any distortion in face? Arm. Can you lift your both hands? Speech. Can you speak properly? Time. If you notice any one of these symptoms, it's time to go to doctor without wasting a single minute. Now what about the diagnosis and tests? As soon as you reach the doctor, you are diagnosed with various methods. The very first one is medical history and the physical examination. The very first thing the doctor will ask about your medical history, as well as the high blood pressure, smoking habit, and family or the personal history of stroke and the heart disease. Next, the doctor performs a physical check. He may check numbness on your body. In addition to that, a doctor may check your mental alertness and your balance and coordination also. Diagnosis test. Later, doctor may perform any one or more diagnostic tests as follows. Computed tomography, that is a CT scan of brain. This produces a detailed picture of injury. The test is painless. The test can show the areas of stroke having blood clots. The second is magnetic resonance imaging, that is MRI. With the help of magnetic and radio waves, MRI creates an image of brain to find out the injury. It can detect the damage to the brain tissues. The third is carotid ultrasound. It may be performed from check the blood flow in carotid arteries, and any plaque can be detected. The fourth one is carotid angiography. In order to receive a more detail of damaged brain tissues, a dye is injected to blood vessel. This dye makes the artery more visible to the X-rays. The third is heart test, echocardiogram and electrocardiogram. These tests provide necessary data of your heart, as size and shape of your heart. How well valves and chambers are working, this is also known. They can detect any clot present in the heart that may cause stroke. Now what about the treatment? The first one is emergency treatment. In ischemic stroke, action will be taken to study your important signs, as giving you medicines like aspirin or any another antiplatelet medicine. Hemorrhagic stroke. In case of hemorrhagic stroke, main focus is to control bleeding, lower the blood pressure in the brain, and make study your important parameters as blood pressure in the brain. If there is bleeding due to a ruptured brain aneurysm, you may be operated to repair the aneurysm, followed by you will be given a clot dissolving medicines. The second is thrombolysis. Thrombolysis is also called thrombolytic therapy. Thrombolytic therapy is a treatment to dissolve blood clots vessels, prevent damage to tissues and organ, and to improve the blood flow. The third one is medications. As variety of medicines are used for people who are at high risk of having stroke. The fourth is surgery. You may need surgery if you have a stroke. What about the prevention and the risk factor? Prevention is better than cure, so follow these steps to prevent the stroke. The very first one is no alcohol or in limited stage. The second is healthy diet. Third is no smoking, don't smoke right that time. The fourth is exercise daily. Fifth is keep control on your blood pressure. Sixth is control diabetes, and seventh is lowering the cholesterol. I hope this video will be informative for you. You may subscribe this channel for other health related videos. You may connect us on Facebook, blog and G+ page. The links of important videos are shown here. You may have a look on these videos. I will come back very soon with a new health information. Till then, bye bye.